Hi, my name's Dan, and today I'm going to talk about the circle of Willis. First, the circle of Willis has four inflows, two vertebral arteries and two internal carotid arteries. The vertebral arteries come from the subclavian arteries and come through the foramen magnum into the calvarium. The first branches off the vertebral arteries are the posterior inferior cerebellar arteries. The vertebral arteries then course superiorly and give off the anterior spinal artery, which eventually supplies the anterior portion of the spinal cord. The vertebral arteries then join together and form the basilar artery. Basilar artery's first branch is the anterior inferior cerebellar artery, which gets kind of the middle of the cerebellum. The basilar artery then extends upward and anteriorly and gives off several penetrating pontine arteries. The basilar tip, which is this portion here, basically splits into four vessels. First are the superior cerebellar arteries, which supply the superior portion of the cerebellum, and finally the posterior cerebral arteries, which supply the occipital lobes and inferior temporal lobes. The posterior system is connected to the anterior system via the posterior communicating arteries. The anterior system is comprised of the branches of the internal carotid artery, first of which is the ophthalmic artery, which supplies the eyes. The anterocoroidal artery usually comes off the distal internal carotid artery and supplies some of the basal ganglia and internal capsule. The carotid artery then splits into the middle cerebral artery and anterior cerebral artery. The anterior cerebral artery is connected to the contralateral side via the anterior communicating artery, all the while giving off several lenticulostriate arteries, which are small arteries that penetrate into the deep gray matter. The anterior cerebral artery has several segments, most important of which is the difference between the A1 and the A2 segment, which is just proximal and distal to the anterior communicating artery. From there, the anterior cerebral artery travels up in the A2 segment until this bifurcation here between the callosal marginal and the pericallosal arteries. The pericallosal artery then continues as the A3 segment, kind of along the superior portion of the corpus callosum on either side. The middle cerebral artery traverses a little bit differently. It traverses along the sphenoid bone. It has a sphenoid segment or horizontal segment, which is also called M1. M1 gives off several lenticulostriate arteries, which get the claustrum and the lentiform nuclei and the extreme, external, internal capsules, things like that. It then travels along the sylvian fissure in the sylvian or M2 segment, and finally trifurcates or bifurcates into cortical segments that travel along the cortex superiorly and inferiorly. M4 segments generally are the small penetrating cortical segments. The posterior cerebral artery is a little bit different. The main thing to remember is that the P1 segment is before the posterior communicating artery, and the P2 segment is after the posterior communicating artery. There are P3, P4 segments that are not in the scope of this talk, but just remember P1 and P2. Most important thing to take out of this talk is the most common sites for saccular aneurysms. I missed my first 3 or 4 5mm aneurysms because I just didn't know where to look. And developing a search pattern where you're looking the most common spots first is very important to success in finding aneurysms, doing things quickly and efficiently. So the most common area that you can form saccular aneurysms is the anterior communicating artery. That's 30%. So I like to look here first. I then usually go to the middle cerebral artery, where the trifurcation and in the junction between the M2 and the M3 segments that usually happens somewhere in the sylvian fissure is a good place to look. The posterior communicating artery is also very important, especially the connection with the internal carotid or middle cerebral artery, depending on where it's joining up. That's a very good spot to look. I've also seen several in the basilar tip. I have not seen one in the posterior inferior, the pica, but it's certainly someplace worth looking and someplace worth noting. The pericallosal artery and the distal A2 is also someplace else to keep in mind. But again, it's good to look in these spots. Obviously, you want to look everywhere, but look in these spots first before you start traversing every single vessel and get overwhelmed and miss things. So, summary of what we've talked about today. Went over circle of Willis anatomy and some of the segments. Again, the biggest take home is that the A1, P1 segments are before the communicating arteries, and the A2 and P2 segments are after the communicating arteries. The M1 segment is the horizontal portion, and then it travels in the sylvian fissure and eventually along the cortex. And probably the most important thing to talk about with the circle of Willis is the common sites for aneurysms. To look at these first is probably the most important thing. So thanks for your attention, and have fun on neuro.